This isn't just a podcast, it's a movement. The Middle Ground Mike is fighting for truth and unity. Subscribe now or support us today. Links are in the notes. Stand with us.
She's like,
Oh my
where's my
God.
party's plan? Where's my party's plan to fix this? And I'd be willing to work across the aisle to get something done about this.
What I loved is she's MAGA, but she's not afraid to challenge the president. And I'm like, and just like Charlie Kirk said, that is our job essentially to challenge everything. And we're a diverse group. And I'm like, and Marjorie Taylor Greene, for a while, it kind of seemed like she just towed the line and did. But I don't know what happened in, I don't know if it was last year or whatever, but she has really been like, she's really come into her own and become her own person. And I used to kind of be like, some of the stuff she would say, I'd be like, I like her. But and now I'm kind of like going, okay, she's making some common sense now. She's not just touting the screaming talking points to try to get her point across. She's actually coming with substance, and I'm like, she could really bring some of the MAGA people a little bit more towards the center to get some things done because of there's a lot of MAGA who don't like her now, to be fair. I guess it's just the substance, is that she's presenting it and she's trying to be a little bit more balanced, especially with healthcare, right? Because she doesn't advocate necessarily a socialized system, but she's like, hey, I've heard her say things about, state level, which I'm for at the state level. If a state wants to come up with some kind of solution like that, if that's what the state wants, that's the state's choice. And if you have a state that can't afford it, right? Like they do it, but there's like shortfalls because of whatever, like an industry collapses. So, the tax revenue comes out from underneath them suddenly. To me, and I know that that's not popular among conservatives, but I think that to me, okay, that's where the federal government can step in to try to go, okay, we're going to help you shore this up till we can get this figured out. There should be a certain kind of, I think there should be something tied into that as well, because you do want to make sure that even if there is an economic meltdown, that, people can still get their health care, but I like that she's very pro doing something of that nature, but also the government not completely taking everything over either. And you know, Europeans have some good ideas, but their system doesn't work here because we don't have that style of government. Like you can't put a European system in America because we don't work like that fundamentally.
Well, but we were talking about this too. Most European countries are the size of a state, if that.
Mm-hmm.
And so it would, they do, but you can also talk to people. Canada has a nationalized healthcare, and a lot of Canadians come here to get specialized services, and there are a lot of delays and there are a lot of problems in some of those systems as well. I have a friend who lives in Costa Rica and she's a permanent resident there. She's an American citizen, and she qualifies for their public health insurance, but she also buys private because for the same reason, getting access to care is challenging. And sometimes the public health insurance won't pay for what her doctor says she needs. So, and again, I think all of these, I think these, you don't have, like nationalized European Union healthcare. You have each country having its own. And, it might be that your healthcare isn't as good in some of the European Union countries as they are in others. And that might be the case in the States here as well.